Welcome. In this session, we're going to be decreasing muscle tissue tension and soft tissue tension like fascia. We're going to be mobilizing joints and hopefully leave you feeling good. We're going to be working for low back and hip work today. So any low back discomfort, whether that's from compression stuff, postural stuff, sciatic kind of stuff, or hip things. We're going to be getting into glutes and hip flexors and all that. So we're going to start off in the low back. So let's come down to the floor and grab a ball. So we're going to grab a ball here. You can use a bigger ball or you can use a smaller ball. This one can actually be really good because you don't have to come up into kind of like a bridge to get on that there. I'm going to use this so you can see it a little bit better. Oop. So we'll grab our ball, come down onto the floor, get ourselves in a glute bridge position, bring a little bit of abdominal tension, and then you're gonna press up to get the ball underneath. And we wanna be just above the hip bone, just above the iliac crest and next to the spine on whatever side you wanna start. Here I'm supporting myself with my feet. I'm bringing in some abdominal tension to support my low back. And then I'm just gonna do some pelvic tilt. So I can kind of feel that hip bone, that the ball's just over top of that and in that nook there between the sacrum, the spine, and the hip bone. You can have your hands down on the floor, just kind of relax, but always keeping a little bit of abdominal tension. And then we're gonna do some pelvic tilt. So let your hips sink down over the ball and then tucking the hips underneath, bringing the pubic bone up towards the ceiling to press the low back into the ball. And then we're going to work out laterally outside, slowly, kind of 1 inch, 2 inches at a time. So do a couple of pelvic tilts there, see how that feels, and then you can move on to the next segment, kind of moving your body here. I'm on the right side, so I'll move my body to the left to move the ball out to the side a bit more. And then sinking in here with some pelvic tilts. Breathing. Here we're looking to lengthen that low back tissue and then shorten it, activating it. The shortening will come in the anterior pelvic tilt, so letting the hips hang over the ball. And then tucking to lengthen, flexing through abdominals to make that happen. And always staying supported, not letting yourself fall off to the sideways on the ball here. Practice your balance skills. And breathing. We want to bring the nervous system down. That's a huge part of what we're doing. We want to connect with the area. And we want to work all the way to the edge. You're going to have to fight for a little bit more balance as you get out to the outside of the hip, getting into maybe the outer abdominals right at the edge of the low back muscles, the erectors of the spine as they're coming up here. Tucking, tipping, and use your intuition. Just if you need to sink in and hold in one place, then you can do that. If you're on the little ball, you'll be a lot more contact with the floor, which can feel a little bit more stable, a little bit more relaxed. Here I have to stabilize a little bit more. Nice. Take as much time as you need on either side. You might know one side to the other that you need a little bit more work through one side. So spend as much time as you need there. I'm going to switch to the other side though. So I'm going to take that ball, get it into my left side now. And then working here, I'm starting next to the spine and working out to the outside of the hip with some pelvic tilts, anterior pelvic tilt, letting the hips sink over the ball, and then posterior pelvic tilt, engaging abdominals to pull the pubic bone towards your sternum in the front, squeezing glutes, and then relaxing, and just breathing here, sinking into whatever area you might need a little bit longer. So just listening to your body and breathing, slowing down. Life is so fast, you know, just bring it down a bit. Just bring it down. Listen to this time is for you. You and your body and your mind. Shut the rest of the world out. Do some pelvic tilts on a ball. Moving out as you need, opposite way to move the ball the opposite way. That's right. And as long as that knee you need on this side. Excellent. I always like to come, after working in the low back, I like to come down to the floor. You can take the ball out and then just some pelvic tucks here. See how that feels side to side. You might get a sense of one side's a little bit tighter. Still, you can get back in there a little bit if you need. Maybe some hip hikes, hiking the hip up to the ribs on each side. See how that feels. That's kind of activating each side on its own in the low back. That feels good to me. We're gonna move on. We're gonna get into glutes. I'm gonna stick with the ball. You can move to the foam roller if you want, or a smaller ball if you want, but I do like this bigger ball for the glutes. We wanna get into deep glute rotators, glute max, the big glute muscle, and outside of the hip here, glute med and min. So we wanna work between the hip bone that we were just above, that iliac crest, and the greater trochanter of the femur as it's coming up. So you might be able to feel that, this bone here that's sticking out. That's where all the deep glute rotators and glute med and min, the side stabilizers, are attaching into. Glute max is attaching into the iliac crest and down into the femur, into the gluteal line. So we're gonna get into the meat of the glutes here. Pressing the shoulders down to support yourself here. And then just kind of ease around with the ball. The more you rotate out to the side, you'll come in contact with a greater trochanter. You come up to the leg bone. That's where all those muscles are attaching. A great area to work is at the muscle attachment, which is attaching into the bone, periosteum, the fibrous tissue around the bone. So work right up to where the ball comes in contact with the bone. Minimum effort, maximum gain. And then some movement here is flexion and extension of the hip. So extending the hip, reaching the heel, flexion of the hip, dragging the heel back up, bringing the knee up towards the kind of the chest area, I suppose. Keep supporting here with the shoulders. And you can search all the way around, squaring yourself up a little bit more to the ceiling or the floor, however your mind works, and that'll bring the ball closer to the sacrum, or rotating the chest and the hips to the side a little bit more, and that'll bring you more to that greater trochanter. And then you can do some movement here. Another great movement would be like a windshield wiper, some internal and external rotation, some adduction and abduction, a little bit of both in there. And just play around here, use your intuition, searching, an inch or two at a time. Don't move big movements. You might skip over some tissue where you might be really needed. And then you can also come around onto the side here. I'm just on the one elbow, pressing into the floor, and I'm getting just above that greater trochanter. This is where we're gonna get into those outside stabilizers of the hip and the knee in the glute med and min. And again, here you can rotate into the floor, adduct, bringing your knee towards the center line, or some flexion, or some extension and some flexion here. And just play with that. Breathing, slowing down. We don't want to get through this. We want to get what we need out of it. So just take your time and listen to that. Depending on what you've been doing lately, you might feel a lot in here or not so much. And lots of driving, sitting. It's amazing how much that can bring tension to the glutes. I don't think of that much, but it's true. I swear to you. I'm going to switch into the other side. Supporting into the shoulders, pressing down, not sinking into the neck here. And breathing, gently searching around. Anytime you need, you can use your hand to adjust the ball. Just not, just careful. Again, you can do some reaching of that heel, some flexion of the hip, some rotations. Supporting yourself. Searching around, working right underneath that iliac crest, the upper hip bone is an amazing place. That's where the glute max is pulling into. And on the opposing side, the upper side, lats are pulling into there, the full thoracolumbar fascia, the erectors of the back, all those muscles attaching into there. So there's a big culmination of pull tension from up and below. So here, just working on that. We already worked on that upper edge. Now we're working on the lower edge here where glutes are attaching into. So a lot of work can be done there. Also, don't forget to get right out into the side, into glute med and min. Not as much here for me on this side, but hey, you're your own person, Listen to what's going on in your body. Don't let anybody tell you what to do. We're going to move on here. We're going to move to along the posterior side. We're going to move into hamstrings. I'm going to switch. You can keep using the ball if you want. I'm going to switch over to the roller here, just for funsies. Not everybody has a ball. Let's give the roller some love. Here we're working right from the sit bone, the ischial tuberosity, all the way across the knee. The hamstrings kind of are a little bit more centralized here, and then they kind of split down by the knee and cross the knee, attach into the fibula, the tibia. So I like to start at the sit bone, just below it, so you can kind of feel the sit bone there on the roller. You can do both at the same time. I like to do one, since my whole torso weight isn't over top of my leg. Doing one at a time allows for just a little bit more weight there. You can also bring another leg over top. The movement here is, again, flexion and extension. This time we're not necessarily, we're thinking more about the knee than necessarily the hip. But it does cross the hip. And about, a couple inches at a time, you're kind of rolling back and forth on. You can sit there, listen to your intuition, and some external and internal rotation of the femur to get into the outside and inside hamstrings conversely. Reach the heel, breathe. Try some different movements, just play around with it. Listen to your tissue. This is also an active A lot of people refer to foam rolling as a very passive care, but it is very active. We're communicating with our nervous system through this external pressure that we're putting in. And we're encouraging ourselves to listen to where tension is and actively release it. Not to mention physical change. We're also looking to apply physical pressure and shear force to create physical change in connective tissue, fascial tissue. That's where the reaching stuff really comes in. And you can work all the way across the knee, kind of focusing more on the inside and the outside of the knee, rather than just through the very back of the knee, especially if you have like Baker's cyst or something, just an expansion of the joint capsule in the back. So just be mindful of that. You know, if you're dealing with that. If you're not, you don't have to worry about it too much. But the vascular tissue and nervous tissue is very superficial there, exposed as well. So that's a thing. And then that internal rotation to get into the inside hamstrings as they cross. And then you can move into the other leg. Again, if you know what's going on with your own body. So you know you need to be in one side more than the other. Stay there, spend a little bit more time there, but always check on the other side. I can't stress that enough. A lot of people get hyper-focused, even in practitioners telling them to focus on that same side of injury, but it depends on how long the injury is going on for. If it's going on for months, years, then there's always compensational stuff going on, especially with the lower leg, because we always walk, we always stand and move, and we're going to make any compensation we can to do that, whether we're making it actively or it's just happening to move around, pain, that kind of stuff. Starting up at that ischial tuberosity, working down the leg. I digress. Some movement. Some internal rotation. You might even get into some adductors, some of the groin muscles going down the inside of the leg. Some major external rotation. You'll be getting into maybe a little bit of the IT band. And then work across the knee. All of these things are pulling into the hips, which will orient and pull into the low back as they pull into the hip. And this lower leg stuff will really, and glutes will help with any sort of knee stuff that might be going on as well. We're not really going to focus into the lower leg, but if you have more knee things going on, you could spend some time there as well. Take your time, slow down. Nice. Keep working there if you feel like you need to. You can kind of shake things out. And then we're going to come onto the front. We're going to work through quads. We're going to work all the way from the anterior superior iliac crest, that little hip bone here where rectus femoris, the main quad muscle going down the center, is attaching to, all the way down to the top of the kneecap, and work to the top of the kneecap. There's a lot of stuff to be done there. Coming down. I like to start at the top, working on one side at a time. Here, supporting yourself, pressing the shoulders into the floor. We're doing a little mini plank from the roller up to our shoulders. We'll grab some abdominal tension. Breathe. And then you can do some flexion and extension of the knee here. I like just to keep my toe on the ground and then pressing the heel, lengthening the heel away from my body. Internal and external rotation. If you're working through both legs at the same time, you can just rotate your hips and get into the inside leg on the one side and the outside quads on the other side at the same time, which can be very helpful for using your time wisely. It's catch-22 because you want to be the most efficient, but I keep telling, slow down, take your time. It's important to take the time to take care of yourself, but life's busy, everyone's busy. It's a hustle nowadays, and thank yourself for carving out some time for you, Give yourself a pat on the back. Good job. And again, like I said, work all the way down to the patella, the kneecap, on the inside and the outside. So here I do a lot of rotation to get into vastus lateralis and vastus medialis. The lateral is outside, medial is inside of the knee. And there's usually a lot going on there. Pressing from the shoulders, anchor the shoulders away from your ears, tuck the pelvis, engage abdominals, support yourself. I support you, support yourself. You deserve it. Slow down, relax. Nice. And we'll come out of that. Take a second, you kind of shake stuff out. Keep working in quads if you feel like you need to. Take the time that you need to there. Surprisingly, I wasn't as tight there as I thought I was going to be. The last place we're going to check in is hip flexors, psoas and iliacus. Iliacus is just right inside the hip bone in the bowl of the pelvic bone, the hip bone, the ilium. And then psoas is attaching into the lower vertebrae, lumbar vertebrae of the low back. And they both come together to attach onto the lesser trochanter on the inside of the femur here. So we need to work through abdominal tissue into the low back. So we're going to take the ball. You can use the foam roller, but I definitely recommend the ball. If you do use the foam roller, just use the very top of it. So you have the top of it into your abdominals below the ribs, about belly button height. But that might change depending on your body. Everybody's body is different. So here, I'm gonna put the ball on the ground. I'm gonna be on the opposite side of where we're gonna work. And then I'm going to slowly ease onto the ball, keeping as much tension as I need on the other side. This can be a very sensitive place to work. There's a lot going on here, emotional stuff, tension. So just relax into it. Give your body time to integrate the ball and relax the abdominal tissue to let it in. And that's how we're going to get to work into the low back. So you can rest your head in your hand. This means that you can kind of let things go a little bit more. You don't have to support yourself as much here in this position. And then you're going to take the same foot as the side that you're working in. For me, that's the left foot. And you're going to tuck those toes underneath. And the movement is going to be reaching the heel, extending the knee, pressing the back of the knee up towards the ceiling. Breathe. You might feel some pulling here. That's connective tissue, fascial tissue. We're also working through all the intestinal tissue, GI tract. So this can be really good for GI stuff, gastrointestinal tract. And then we want to be just to the side of the belly button, whichever side you're working on, just to the side of it, and just below it. But you can adjust things. Iliacus is, like I said, on the inside of the hip bones. You could come up even more and bring that a little bit across the pelvis and into that inside of that hip bone there. Same movement. Extension of the knee, reaching the heel, extension of the hip. Breathing, relaxing, questioning why you're following me doing this. Because it'll help you, I swear. I worked in here a lot as a restroom massage therapist, and there's always something. Always. Especially all the seated posture. Hip flexors are seated. In a seated position, hip flexors are shortened and often tight, creating tension, And for some people, that's 7 hours a day. And then you come home and you sit on the couch or at the computer and play games or work on other stuff or draw or whatever it is. Slow down, breathe, take your time. Searching around very slowly. And then we'll gently ease out of that. And come into the other side. Ease in there. Slowly let the ball in. Take your time. When you're ready, just outside and below the belly button. And then when you're ready, tucking the toe underneath and reaching. Breathing. Let the ball in. Breathe. Search around a bit. This is a huge part of low back discomfort. Hip flexors pulling into the low back on the front. This push and pull, or pull and pull, muscles only pull, between the low back and hip flexors. And then always, when you're coming out of hip flexors, come out nice and slow. Oh, changed man. Take a breath. Come back to reality. Great job. Thanks for taking this time for yourself. Take it easy. Grab some water. Take care of yourself. And yeah, we'll see you in the next one.